Welcome back to It's Personal, brought to you by Gunderson Lutheran. I'm Christopher. Gunderson Lutheran is one of the first medical centers to perform the LINX procedure to treat gastroesophageal reflux disease, also known as GERD, which, by the way, is a lot easier to pronounce. And prior to recent FDA approval, Gunderson Lutheran was among 14 centers nationwide performing the procedure as part of clinical trials. Dr. Kothari is here to talk a little bit more about this. First of all, talk a little bit about GERD. What is GERD?
Well, as you said, GERD, or gastroesophageal reflux disease, is a disease process in which acid contents that belong in the stomach and were designed to be in the stomach splash up into the esophagus or your food pipe, causing irritation and symptoms, often, as we call it, heartburn.
Heartburn. A lot of people think, well, why can't you just, take something for heartburn? How does it become, and I'll say, a bigger issue?
Well, that's a great question. Heartburn ranges from intermittently bothering you, just patients once or twice a month, to a daily debilitating problem for several million patients. And it can range from causing no damage to the lining of your esophagus to significant damage with inflammation, scarring, narrowing of it, so that it can cause things such as difficulty swallowing and other symptoms as well.
Talk about some of those other symptoms, and talk a little bit, if you would, about how this gets to that point where surgery is recommended.
Yes. Well, the underlying problem is the valve between the esophagus and your stomach is not working properly. For whatever reason, that valve pressure is low, allowing those acid contents to splash up into the esophagus. So as surgeons, our treatments focus on strengthening that valve or making that valve stronger. Now, traditional surgical techniques have used the stomach itself and wrapping the stomach on itself to help strengthen that valve or augment that valve or make that valve stronger. Now, that surgery's been around for decades, and over the last 20 years or so, we've been doing it laparoscopically, meaning with a minimally invasive approach. However, there are some side effects to that procedure, such as bloating can occur, and some people cannot belch or vomit after that procedure. Their symptoms may be gone, meaning the acid is not splashing up as much, but it is not without some side effects. And it does involve altering the surgical anatomy of your stomach. I mean, your stomach is not divided, but it is wrapped on itself to create this valve. And sometimes over time that valve or that wrapping can come undone, and the surgery needs to be redone again when the symptoms come back for the patient. So the LINX trial was an innovative trial with a very unique device which uses a ring of magnets that are placed also laparoscopically or minimally invasively around this junction, around this valve between the esophagus and the stomach. And the nature of magnets is, as they are closer together, they are stronger, and when they're farther apart, they are weaker. And it is the perfect technology to allow for making this valve or this sphincter stronger.
Now, this procedure, as we said, has now been approved by the FDA. It's something that we've been working on for a while now at Gunderson Lutheran. What are the results?
Yes, we were one of the, as you said, one of the 14 centers in the U.S. that was part of this trial. This occurred over 3 years ago, and we have followed these patients now over the last 3 years. And there is a remarkable improvement, not only in the patient's symptoms, meaning the patient saying, I feel better and I'm not having my symptoms, but with objective data, meaning when we test using pH, the amount of acid that is splashing up, it is significantly reduced following this surgical procedure.
Is the procedure harder or easier as a surgeon?
Well, all surgical procedures have what's called a learning curve to them, meaning where you have to really master the procedure. But what's unique about this device is that not only is it laparoscopically placed, there's no altering of the of the gastrointestinal tract. There's no dividing of tissues and things of that nature. And it's outpatient surgery, meaning the patients come in the morning, they can undergo the procedure, the vast majority can go home later that same day. And unlike the traditional procedure, the Nissen fundoplication, which is the stomach wrap surgery, those patients have to be on a liquid diet for up to 2 weeks before they can advance to more solid foods. What's unique about this device is these patients can be on solid foods immediately after discharge from the hospital.
So are patients then sort of given the option to say you can have the old procedure, you can have the new procedure, and what are they saying to you when they're going through that choice, if that is the case?
My job is to inform the patients of their options and help them to make a well-informed decision, whether that's for surgery or against surgery, and if it is a surgical intervention, is it for the traditional stomach wrap surgery versus the more newer and novel LINX device. Clearly there's advantages and disadvantages to both approaches if a patient is choosing a surgical option. With the new device, we have we don't have 5 and 10 year data. It's so new and so cutting edge, and we were one of the first centers to offer it, that we don't have 5 and 10 year data. So we don't know some of the longer term side effects of it. There are some patients who are candidates for both, but there are some patients who are not candidates for the LINX.
Talk about that, if you would, a little bit.
A patient who would not be a good candidate for the LINX device would be a patient who has a BMI, or body mass index, which is a calculation of their height compared to their weight, of over 35. So if the patients had a BMI over 35, we would not offer this procedure. We'd offer them a different procedure or encourage them to lose weight to qualify, if you will. If they have a hiatal hernia, which is an opening in the diaphragm muscle that allows the stomach to slide up into the chest where it does not belong. If that hernia is more than 3 centimeters in size, then this device would not be applicable for that patient. So there are some anatomic changes that patients have in their body that would prevent them from being a good candidate for this device. Of course, others would be if they have a nickel or metal allergy, then we could not do the device, and patients also need to be cautioned that since it is a metal and it is implanted, they cannot have an MRI after this procedure because of potential risks of that.
We're talking with Dr. Shanu Kothari, a surgeon here at Gundersen Lutheran, and he's talking about the LINX procedure, which is really, helping to solve GERD. And talk a little bit, if you would, about sort of the symptoms, the warning signs that somebody maybe should be having this looked at a little bit closer.
Okay. Patients often complain of a burning sensation in the chest below the breastbone. Often there is a sense of coughing at night, waking up coughing, or feeling a taste, a sour taste in the back of one's throat. These are some of the symptoms that might be consistent with heartburn, or what we call GERD, gastroesophageal reflux disease. Also, some patients not only have the symptom of heartburn, they also complain of regurgitation, meaning contents literally, physically coming up, or if they bend over or tie their shoe, they physically feel something coming up and filling up in the back of their throat. Often this is reflux and regurgitation because the valve is not working properly, allowing these contents to splash up where they don't belong.
Gotcha. Can you say what the first step would be if someone has those symptoms? Talk to your primary doctor? What would your advice be there?
First recommendation would be to seek consultation with their primary care provider. They are excellent at screening patients to see if there's warning signs of something more ominous, as opposed to, does this require a trial of medication to see if you get better, and if you don't get better, are there next steps in terms of investigative tests to document the severity of reflux disease.
Dr. Kothari, we're out of time. Thanks for joining us today.
Thanks for the opportunity.
And again, if you'd like to learn more about the LINX procedure, it's the innovative new procedure for reflux disease, you can certainly go online